Our broadcast tonight with the world's fight against malaria. April 25th is World Malaria Day, an opportunity to shine the spotlight on the need for continued investment and increased political commitment for malaria prevention and control. Joining us now is Africa 54 health correspondent Lino Mudu with new information on malaria vaccine program. Lino?
Thanks, Esther. Well, the World Health Organization has announced that trials of a new malaria vaccine will take place in 3 African countries, Kenya, Ghana, and Malawi. They have been selected for their high prevalence of malaria and strong existing immunization programs for other diseases. The announcement was made ahead of the UN's World Malaria Day today, April 25th. As Henry Ridgwell reports, the chosen theme for this year is a push for prevention.
Malaria remains one of the world's deadliest diseases, killing close to 500,000 children every year, mostly in Africa. So the testing of a new vaccine called RTSS has been greeted as a great step forward. It is hoped that 360,000 children will be vaccinated between 2018 and 2020 in Kenya, Ghana and Malawi.
We're very appreciative that GSK, the pharmaceutical company that is developing the vaccine, will provide this free of charge for this pilot. And the vaccine will be assessed as a complementary intervention in Africa that can be added to our existing toolbox of proven preventive, diagnostic and treatment measures.
While a malaria vaccine would be an invaluable tool, other methods remain vital in preventing malaria, says Dr. Thomas Churcher of Imperial College London. He uses mathematical modelling to highlight the best way of blocking the main vector that transmits malaria, the mosquito.
Currently, the majority of control is through the use of bed nets, but there's increasing fear that mosquitoes are becoming resistant to some of the insecticide on those bed nets. And so there's a chance that control that works today might not work as well in the future. And so what we need to do is we need new types of ways of killing mosquitoes, new types of bed nets, new types of drugs, new types of vaccines.
Global efforts to reduce transmission have led to a 2/3 reduction in malaria deaths between 2000 and 2015. It's hoped the development of a vaccine will get us one step closer to one day eradicating the disease.
Hopefully one day we will have a vaccine that's good enough to be that silver bullet, but the current vaccine can do an awful lot, but it is not going to completely halt malaria transmission. And so therefore the recent studies show that it's partially effective and that effectiveness wears off quite quickly over time.
The $50 million trials in Ghana, Kenya and Malawi are being funded through a network of NGOs and global institutions. Far greater investment will be needed to roll the vaccine out globally if the pilots prove successful. Henry Ridgwell for VOA News, London.